Well, hey everybody. This is Dr. Raynette Ilg, naturopath, and I thought we would talk about something a little different today. Today I wanted to talk about seasonal affective disorder or a light amount of depression. So if you live in the Midwest, you've suffered through that awful, awful time change. You know, spring ahead, fall back, it just messes with your body. And to top it off, I don't know if you can see behind me or not, but it's pretty gloomy out today. And that just doesn't help things because we need the sunshine to help make us feel good. So I wanted to give you a few good tips on how to feel better during these gloomy days and until your body gets acclimated a little bit better to the time change. One of the first things we can do is you can go ahead and eat a little more protein. Protein has tryptophan in it, yeah, the stuff that makes you sleepy after Thanksgiving meal. But protein with the tryptophan in it gets converted to serotonin. You know, the I feel good, you feel good, let's all skip and have lunch kind of feel good thing. Well, that serotonin then gets converted down the line to melatonin, the stuff that makes you sleep good. So that's one of the first things you can do. Get a little more protein in. Now, whether it's from meat, fish, cheese, eggs, nuts, just get some more protein in. Or even if you wanted to do a protein shake, that's a good thing too. The next thing I wanted to talk about was maybe getting a little more vitamin D in pill form. The pill form of vitamin D is a fat-soluble vitamin, so you have to take it with dietary fat in order for it to be absorbed. That's the second item. How much vitamin D? Well, you have to have your vitamin D levels checked. We don't just arbitrarily start dumping things down our throat to get nutrients in. Oh, remember, too much of a good thing is still too much. The next thing I wanted to talk about was some light therapy. Now, I don't know if you can see, we're in fluorescent lights here, and a lot of you, if you're at work, you're working under fluorescent lights, there's a lot of time there's not enough sunshine out, but there's something else you can do. Go online and get something called a blues buster bulb and put that in the light that you would sit closest to when you get home. You see, when we can get that day and night schedule all cranked out and working great, we get good sleep, we tend to feel better. Now light, the good light from the sun is obviously the best, but when we can't do it, we have to use some artificial light to get us going. So get yourself a blues buster bulb and put it in the lamp that you usually have sitting right next to you when you're watching TV or something or reading in the evening. That should help get some of that serotonin up. Remember, be good to yourself, and please, please remember, the bagels and the cookies and the candy and the pop and all those things make you feel good temporarily, but they crash you down further. So if you're suffering a little bit from feeling a little blue today, remember, go get some good old-fashioned tryptophan, some vitamin D, and some great light in. Those will be the things that are going to help make you feel better and feel better over time. Just because it's winter doesn't mean you have to have a bad day. So this is Dr. Ray from Olive Branch Wellness Center, giving you the strength for living good health brings. We'll see you next time.